How you feeling? Long time no see. Hey, we're talking about healthcare here.
The debate over health insurance reform continues, and the Community Health Project keeps an eye on the experiences of real people. Again, wandering the streets of Portland, we find stories about how people care for their health with and without insurance.
I lost my insurance a couple years before. I had spent 10 years taking care of an invalid parent and basically used up most of my resources taking care of her. I have no health insurance. I'm barely working. I had major heart surgery 4 years ago. Well, almost 4 years. I mean, we're talking about $400,000 with the hospitals and the doctors and the surgery and everything. I went through bankruptcy a year ago.
They said, hey, gee, we didn't get your form. We got your money, but we didn't get your form, so you're off. And I said, what? Can I get my money back? And they said, no. To go see my doctor to get my prescriptions filled, $106 every 2 weeks.
They found me out in the wilderness and took me up to OHSU. I was at OHSU at the time because I had severe frostbite. And so because of the application with the disability and because of my age, it was automatically going to go into the system. I wasn't even with it at the time anyway. And it just automatically went in. And then I found out that they were going to subtract all this money. Well, they were going to cut off both feet and one leg, and I said no. Eventually I lost 5 toes, and I knew I would eventually lose something. And I just simply took care of all my dressings and all the treatments and everything, because I used to be a nurse anyway. If I hadn't, I would have died from infections, yeah.
When I was 5, I got great health care. I'm grateful to be walking right now. They took skin from my legs.
I need to have a sense of humor.
Spent 18 hours in the ER picking dirt out of the leg, you know. And it was after Hurricane Hugo on St. Croix. So it was a tent hospital. The hospital got destroyed, so I was in a tent hospital for close to 3 weeks, and then got flown up to Philadelphia, Children's Hospital of Philadelphia.
Heartbreaking.
And that's where they did the skin grafting.
I'm gonna
Worked
cry.
on all that. And that was good, you know, that was the best health care I've ever had since then. My family's not rich, you know.
After I had the surgery, I was home within 10 days and had no follow-up. So I went online and I found out what I needed to do, and I did it on my own, basically. I had gone back to school, and all these kids, basically, that were in my classes, the same class I was in, just sort of pitched in and helped me get through it. I had the surgery and I was back in school less than a month later. And it was a Thanksgiving break. Then I had the surgery and it was back in and finished, and then actually graduated the following term with the class. So
The people we talked to found a great deal of strength in self-sufficiency and the support of their community. And that's what the Community Health Project is all about. So what do these voices of Portland want to see happen in the world so they can be healthy and happy?
What's in your dream healthcare?
Clean water, clean up the world, clean up the environment, and we won't get sick. Simple as that.
you really have to take charge of your own health care. Education is the biggest thing. It's more important than almost anything else.
I'm just concerned about the next generation and the people that are suffering.
What kind of work do you want?
I'd like to landscape.
I'm gonna be a pimp.
Okay, thank you.
Thank you.
Bye.